Dr. Kevin Kavanagh joins us now. My buddy Dr. Kavanagh is a retired physician and founder of Health Watch USA, a national organization. Tell us what Health Watch is, Doc.
Well, Jack, we're a 501c3 nonprofit organization. We have a national presence, beginning to have a worldwide presence with membership, and we're both a patient advocacy group and a healthcare policy group specializing in research integrity with infectious diseases. So this COVID-19 pandemic is kind of right up our alley, and we've been, I think, to the forefront of a lot of the policy and analyzing the data that's coming out, etc. So we've been quite active these past couple of months.
Well, you can't talk about it now without talking about the Delta variant that is rapidly rising.
Well, that's correct. And if you can remember, we talked about this at the beginning of June, even before it was on the CDC's public radar. And the Delta variant's very concerning. People need to really take steps to protect themselves. I would not recommend large gatherings. Positivity rate now is, well, it was just under 9% on Friday. I would suspect by today it will be well over 9%. And the case average in Kentucky, 7-day moving average, is 1,200 and rising. We've talked about long COVID, so even if you're vaccinated and you get mild symptoms, you still may get very sick with the disease. But as far as becoming hospitalized or becoming dead, which is something everybody wants to avoid, vaccines are extremely protective. So it is imperative everyone get vaccinated. Now, the one carve-out, which I think is really disturbing and may need some action by the state, is that we were very efficient in Kentucky of vaccinating our elderly early on. I think even towards the end of last year and in January. And data out of Israel is showing that the Pfizer-BioNTech vaccine's protection is waning in that group. And Israel is going on ahead and giving them a booster. We've seen data where they're getting both hospitalizations and deaths. Now, it may not be as common as the unvaccinated, but still, it is disturbing enough that Israel's giving a third boost, and that's something I think needs to be considered in the United States and in Kentucky.
For all three vaccines?
Well, we only have data on the Pfizer. The Moderna vaccine may give you a little bit better protection. That is still up in the air, but certainly, well, if you're going to act on the side of caution, you would consider getting it from Moderna. Johnson & Johnson, we don't even have hardly any data on that vaccine and how it's doing with the Delta variant, and that is really a shortfall of the CDC. We need to get our data.
I totally agree. Now, if you are an adult and you are fully vaccinated, are you recommending masking in public, period, in or outside?
Definitely. And I would think an N95 mask. Remember, this variant is over 2 times as infectious, produces, even in the vaccinated, 1,000 times the number of particles as what the wild-type virus did. Vaccinated individuals have been shown to be able to spread the virus, and this is quite concerning. So yes, I would definitely inside. If you're outside and around people, wear a mask. If you're within 6 feet of that person, those aerosols won't dissipate, and you also can get droplet spread. Outside of 6 feet, you may have some safety outside, but inside, poorly ventilated area, I wouldn't think anywhere is safe. And of course, N95 masks are the best. You can pick those up on Amazon or order them off that company we've been using, Uline, which is the letter U, L-I-N-E. And I would suggest that everybody do that. For me, I'm going back to ordering online and doing curbside pickup rather than going into indoor facilities.
Can you get them? Are the N95s available? I know at one time they weren't.
Well, Uline you can. I've ordered a bunch of them for friends over the weekend.
Very good. I appreciate it very much. We will talk to you on Friday.
Thank you, Jack.